Welcome to this informative video about autoimmune uveitis, a complex inflammatory condition that affects the eye. Uveitis, in general, refers to inflammation of the uvea, which includes the iris, ciliary body, and choroid. When this inflammation is caused by an autoimmune response, where the body's immune system mistakenly attacks its own tissues, it's known as autoimmune uveitis. This can lead to significant vision problems if left untreated. The exact cause of autoimmune uveitis is often unknown, making it idiopathic in many cases. However, it's strongly linked to underlying autoimmune diseases. Some of the associated systemic conditions include rheumatoid arthritis, ankylosing spondylitis, sarcoidosis, systemic lupus erythematosus, and inflammatory bowel disease like Crohn's disease and ulcerative colitis. Genetic factors also play a role, with certain L gene variants being associated with an increased risk. In some instances, infections like herpes or toxoplasmosis can trigger an autoimmune response leading to uveitis. In autoimmune uveitis, the body's immune system mistakenly identifies components of the eye, particularly the uveal tract, as foreign invaders. This triggers an inflammatory cascade. Immune cells, such as T cells and B cells, infiltrate the uvea, releasing inflammatory mediators like cytokines and chemokines. These mediators damage the delicate tissues of the eye, leading to swelling, redness, and disruption of normal function. The inflammation can affect various structures within the eye, including the iris, ciliary body, choroid, retina, and even the optic nerve. Autoimmune uveitis affects people of all ages and ethnicities, but is more prevalent in certain groups. The incidence is estimated to be around 17 to 52 cases per 100,000 people per year. While it can occur in children, it's more commonly diagnosed in adults between the ages of 20 and 60. Certain autoimmune diseases that predispose individuals to uveitis, like ankylosing spondylitis, have a higher prevalence in specific populations, indirectly influencing the epidemiology of autoimmune uveitis. The symptoms of autoimmune uveitis can vary depending on the location and severity of the inflammation. Common symptoms include eye redness, pain, light sensitivity, photophobia, blurred vision, floaters, spots or lines in your vision, and decreased visual acuity. In some cases, particularly with posterior uveitis, vision loss can be the primary symptom. The onset of symptoms can be gradual or sudden, and the condition can be unilateral, affecting one eye, or bilateral, affecting both eyes. Diagnosing autoimmune uveitis involves a thorough eye examination by an ophthalmologist. This includes checking visual acuity, measuring intraocular pressure, and examining the anterior and posterior segments of the eye with a slit lamp. Dilated fundus examination is crucial to assess the retina, choroid, and optic nerve. Further investigations may include blood tests to look for underlying autoimmune diseases or infections. Imaging techniques like fluorescein angiography and optical coherence tomography (OCT) can help visualize the inflammation and assess the extent of the damage. In some cases, a biopsy of the eye may be necessary to confirm the diagnosis. Autoimmune uveitis can be classified based on the location of the inflammation within the eye. Anterior uveitis, affecting the iris and ciliary body, is the most common type. Intermediate uveitis involves the ciliary body and vitreous. Posterior uveitis affects the choroid and retina. Panuveitis involves inflammation in all three areas: anterior, intermediate, and posterior. The classification helps determine the specific treatment approach. The primary goal of treatment is to reduce inflammation and prevent vision loss. Corticosteroids, either in the form of eye drops, injections, or oral medications, are the mainstay of treatment. Immunosuppressant medications, such as methotrexate, azathioprine, and mycophenolate mofetil, may be used to control the autoimmune response, especially in severe or chronic cases. Biologic agents, like TNF inhibitors and other targeted therapies, are also increasingly used to manage refractory uveitis. Additionally, treating any underlying systemic autoimmune disease is essential for long-term control of the uveitis. Regular monitoring by an ophthalmologist is critical to adjust treatment as needed and prevent complications like glaucoma, cataracts, and vision loss. Unfortunately, there is no specific way to prevent autoimmune uveitis, especially if it's linked to an underlying autoimmune condition. However, managing underlying autoimmune diseases effectively can reduce the risk of uveitis flares. Regular eye exams are crucial for early detection and treatment, which can help prevent vision loss. Protecting your eyes from injury and infection may also help reduce the risk. The prognosis for autoimmune uveitis varies depending on the severity of the inflammation, the underlying cause, and the response to treatment. With prompt and appropriate treatment, many individuals can maintain good vision. However, chronic or recurrent uveitis can lead to significant vision impairment. Recent research is focused on developing more targeted therapies with fewer side effects. Studies are exploring the role of specific cytokines and immune cells in the pathogenesis of uveitis. gene therapy and stem cell therapy are also being investigated as potential future treatments. Continued research is crucial for improving the long-term outcomes for individuals with autoimmune uveitis.